Welcome back to News Now on PNC. If a person with suspected Ebola were to arrive on Guam, is the government prepared to handle this situation? The answer is no, according to some local doctors. But public health officials say they are ready and they have a plan in place.
And for deciding if we're ready is how serious the government is taking Ebola. If they don't think one is even going to get exposed to Ebola, we're not ready.
Some local physicians are taking a stand against Department of Public Health's claims that it is prepared to handle an Ebola outbreak on Guam. Family practitioner Dr. Vince Ekimoto says last Thursday the Guam Medical Association notified Public Health that it would conduct an unannounced drill on handling Ebola.
This weekend we did our private drill to test our capabilities and to follow the advice of our public health officials. We found out that there were deficiencies.
For example, Dr. Akimoto says when they conducted their drill and contacted 911, EMTs said they had not yet been advised on what to do. There are no personal protective equipment on island, with the exception of hazmat certified personnel.
The phone number for physicians to call to talk to somebody who's got a plan, which hospital is going to receive the Ebola patient, when and if she shows up, those things aren't ready.
In fact, Akimoto says public health's reaction to the situation thus far is not acceptable. He says the response he's heard from the government is that Guam should not worry because the likelihood of Guam seeing an Ebola case is slim to none.
If the criterion for deciding if we're ready is how serious the government is taking Ebola, if they don't think one is even going to get exposed to Ebola, we're not ready. So for the government to say it's ready, but acknowledge that they haven't even talked to the private clinics in a real and constructive way.
However, Dr. Akimoto acknowledges that although the island isn't where it needs to be, it has made progress in the last few days.
We need to be ready for any disease like this, and what this is doing is it's making us stronger. It's also forcing us to deal with some unpleasant realities on the eve of an election.
In a text message, Public Health Director Jim Gillen said public health is in the process of training first responders, and he notes that private clinics already have guidance on what to do with a suspect patient. Gillen also says that they are ordering the CDC recommended gear to be able to handle Ebola.